You may also have seen reports that South Carolina is one of the worst states in the country when it comes to giving out the shot. But is that true? News 19's Devin Johnson has that answer tonight.
CDC website, South Carolina is currently ranked last in the country in terms of COVID-19 vaccines distributed. That data shows the state has received a little bit over 8,600 vaccines per 100,000 people. Neighboring states, including Georgia and North Carolina, are doing better by more than 2,000 vaccines. Meanwhile, Alaska has the highest rate, receiving more than 21,000 vaccines per 100,000 people. Data also shows South Carolina has the third lowest rates of vaccines administered, falling behind Nevada and Alabama. Just over 3% of South Carolinians have received one or more doses, and less than 1% got 2 doses to protect them fully. However, part of the explanation may be the time lags between reporting from the CDC and DHEC, says DHEC's interim public health director, Brennan Traxler.
The CDC may get slightly ahead of us, such as what's been shipped to us, maybe if it hasn't landed, for example, in the state yet. And some of it then we will be ahead on. For example, just off the top of my head, one would be if we have had doses that were just inputted into the system, and we have a more up-to-date administered number. But this can go either direction for any of those calculations.
She also says definitions between allocated and shipped could be to blame, also slightly skewing the numbers. But Traxler said South Carolina is catching up to other states. Still, some state lawmakers say the pace of vaccines is frustrating.
It's just doubly hurting those poor rural counties like Fairfield that don't even have a hospital as a mechanism for getting these vaccines out.
South Carolina is still in what's known as Phase 1A, a limited group of people who can get the vaccine. A chart created by DHEC shows Phase 1B to begin sometime early spring. Health officials are deciding who should be in the phase, which is expected to have a population for more than 573,000 people. DHEC's leader also recently acknowledged the low supply of vaccines to the South Carolina legislature. The health department is hoping for a significant increase.
Until vaccine ramps up significantly, the amount of vaccine coming into the state ramps up significantly, it's going to be a slow process.
In Columbia, Devin Johnson, News 19, WOTX.